Vanakkam, Namaste and welcome to Dr. Shah's Clinic. In this video, we are going to discuss on sexless marriage treatment. This is the continuation of our previous video, which is part 1 of the video of sexless marriages. We looked at what are the causes of sexless marriage and what is basically a sexless marriage. In this part 2 video on sexless marriage treatment, we are going to look at the different treatment options that we can offer to couples who come to our clinic with a sexless marriage or non-consummation of their marriage. So, if a man has erectile dysfunction and if that's the reason for a sexless marriage, we basically put him on an excellent food chart, which is a low carb diet. We advise walking for 60 minutes. And number 3, we give him PDE5 inhibitors, which are basically tadalafil, sildenafil, udinafil, vardenafil. There are a variety of medical drugs that are available to treat erectile dysfunction very, very successfully. And we also give what's very importantly something called as psychosexual therapy combined with cognitive behavioral therapy, which is also called as CBT, which will basically help the individual gain a positive feeling towards sexual intercourse, help him overcome his negativity, overcome his performance anxiety, and help him actually perform and have successful and a very happy sexual life with his partner. So psychosexual therapy with the PDE5 inhibitors, which are basically medications for treating ED, combined with food habit changes and lifestyle and other lifestyle changes is what we commonly advise for patients with ED. Now, in some individuals, sexless marriage can be because of a condition called hypo-active sexual desire disorder. And what we look out for in this condition is elevated prolactin levels in the bloodstream. So when the patient and couple comes, or if the man is diagnosed with hypoactive sexual desire disorder, what we basically have to do is check his blood prolactin levels more than anything. Also to check his thyroid, because both elevated prolactin as well as hypothyroidism can lead to decreased sexual interest. So if there's hypothyroidism, we correct the hypothyroidism. If there's elevated prolactin levels, we start the patient on a drug called cabergoline for over 12 weeks. It's one tablet is taken per week. The dose can be anywhere from 0.25 milligram to 0.5 mg. We correct the hyperprolactinemia. The sexual interest is usually restored in these patients, and then they're able to have sexual intercourse. Again, we give them drugs for erectile dysfunction. We give them cognitive behavioral therapy along with psychosexual therapy. Now, if the individual is addicted to masturbation, masturbatory behavior, prone masturbation, what we have to do is basically start the patient on, again, psychosexual therapy, and we also give counseling to the patient, and we we do something we do something called as cognitive restructuring. So what we do is we tell the patients, we teach the patients, we make them, we kind of reorient their sexual behavior completely in a way that they can slowly let go of the masturbatory habits and slowly shift over to conventional sexual intercourse. It takes about 8 weeks. The cognitive restructuring therapy that we do here takes about 8 to 12 weeks. But a large proportion of patients who get into the program are basically able to come out of their behavioral addiction problems to masturbation or prone masturbation. And sexual intercourse comes very, very slowly with their partner. So we give them medications to boost their overall erection, the ability to sustain the erection, with cognitive restructuring, with therapy, again CBT, REBT. There are variety of psychological and psychosexual therapies that we offer to patients. It depends. It's a very individual thing, depending on the patient, and then we kind of help them through this, through coming out of their addiction problem to masturbation or prone masturbation. Now, in some patients, in a very small proportion of patients, say less than 1% of patients, right, with men who are in sexless marriage, patients do not enter into sexual relationship with their wives because they have doubts on their sexual orientation. So some patients may feel that that they are homosexual by nature, and they have entered, but because of the family situation, because of the prevailing cultural conditions, they were maybe forced into the marriage, and they still have doubts about their sexual orientation. And these patients develop what's called as an obsessive compulsive disorder thought pattern about their sexual orientation. So it's some kind of an OCD, right? And these thoughts constantly recur in the patient's mind every time he goes to try sexual intercourse with his partner. And because of these thoughts, the thoughts are so disturbing that every time he looks at his partner, there's no attraction, there's no desire, there's no libido, and he cannot sustain his erection. So what we try to do is, in these cases, we try to break that thought pattern, and we also give him medications to break the OCD. And after that, we treat him with, again, medications for ED, again psychosexual therapy, CBT, food and lifestyle changes, and try to help them. And we have had reasonable degree of success in at least patients who are slightly unclear about their sexual orientation. We've had reasonable degree of success helping them choose their orientation appropriately, of course depending on the individual. It's all about the individual, right? Sexual orientation is a very individual thing, so we respect that part of the individual, of the patient. We help them, take a decision and move on with their life, or we help them stay in the marriage and kind of overcome their difficulties. So the variety of extremely complex treatment strategies are used for treating men, who are in a sexless marriage, at least in our clinic. As far as women are concerned, with respect to sexless marriage treatment, primarily the first thing that if a woman has vaginismus, right, because the commonest condition that we see in women in a sexless marriage is usually vaginismus followed by hypo-active sexual desire disorder. That's less common. Most women have adequate desire towards sexual intercourse. Less than 5%, less than 3% of women may have a desire problem. But if the woman has vaginismus, it's very, very difficult for the female partner to engage in sexual intercourse, because sex itself is bloody painful. It's very hard. And, if the man even tries to penetrate, she's going to freeze, she's going to paralyze, she's going to push him away like that. It's going to bring both her legs together, and the man cannot penetrate. He will lose his erection as a consequence of she tightening her lower abdominal muscles. It will be like hitting a wall. So that's the condition called vaginismus. Right? For vaginismus, we put the female partner through what's called as a sexological gynecological exam. So what is a sexological gynecological exam? So we have a trained female gynecologist who will basically gently educate them on their sexual behavior, as well as their sexuality, and a lot of other things related to sex in general. And it will be a gentle physical examination is done while taking explicit permission from the patient and telling them that to kind of relax them, because the second conventionally if a gynecologist does a single finger penetration or a two finger penetration, that also the woman will violently go back on the table, will jump back and push the gynecologist away. So the sexological gynecological exam, it's a more how do I tell it? It's a more sophisticated way of examining a woman with vaginismus or genitopelvic pain syndromes. So the patient is guided through the examination, and slowly, gently, at the patient's comfort, the exam is done. So basically, we do an examination, then we do blood testing for the patient. We look at the female patient's sex hormones. We also do a basic cholesterol, thyroid, sugar assessment for the female patient, and we give in-depth psychosexual counseling to the female patient. We completely re-educate the patient on human sex, sexuality, sexual behavior, everything else. Basically educate and empower the female partner on it. That itself resolves about 20 to 30% of the problem. Then, in patients with vaginismus, largely what we do is we encourage the patient to try sexual intercourse in a woman on top position, because in a woman on top position, as you can see on the photo on the right side, penetration is usually easier, especially for couples in a sexless marriage. If you try a woman on top position, basically what happens is the female partner can take the organ and guide it into her organ. So penetration is usually much more easier for such patients there. So we encourage a woman on a top position, and we try and we tell the patient to go with something called as a graded penetration, over a protracted period of about 8 weeks. So week 1, there will be only touching. Week 2, the female partner has to take the male partner's organ and try only 1 centimeter penetration. Then week 3, it's about 3 centimeter. Week 4, 4 centimeter. So little by little, the female patient voluntarily exposes herself to that what she's afraid of, which is basically sexual intercourse. So when female patients with vaginismus are put through this graded penetration with a woman on top position, they slowly overcome their fear of sexual intercourse, and eventually what happens is they are able to achieve satisfactory sexual intercourse. Of course, it doesn't work in all women. Some people have psychogenic vaginismus, which is very hard to overcome and treat, and that could be because of a childhood abuse. Clinically, we have seen some patients who have been abused in their childhood, sexual abuse in their childhood. We have seen even men who have been abused, as well as female patients who have been abused. And what basically happens with these individuals is, when they are trying sexual intercourse with their intimate partners, they see flashes or memories of their abuse playing in front of them. Immediately, there's a complete loss of desire, both in the man as well as in the woman. So for these patients, basically what's happening is, because the abuse was so severe in their childhood, they have some form of PTSD, a minor PTSD, which is basically a post-traumatic stress disorder, and that has to be resolved before they get desire in conventional sexual intercourse. So those treatments are a bit more complex. I'll make a separate video on that. But in general, for vaginismus, guided penetration, sexological gynecological exam combined with a graded penetration usually helps and works wonders. So sexless marriage treatment, is dyadic, right? So it involves two partners. So there are separate treatment strategies for the male, there are separate treatment strategies for the female, and in some individuals, the male may have a problem, the female may also have a problem. Either way, it takes about a month or more to, sometimes takes about a month, sometimes it takes about 2 months to, treat individuals or couples with sexless marriage. The biggest mistake most couples tend to do is, if they are in a sexless marriage, a baby is not born, fertility is definitely going to be impaired. They tend to go for IVF, but they tend to do something called as IUI. They go to the fertility clinics, they're taken for a ride. And the reason is because you have to resolve the sexless marriage first before planning for a baby. And the reason is quite simple, because one, you can have your baby, sure, but once the baby becomes 2 years of age and 3 years of age, you're still going to be resentful. Again, your mind is going to search for the sex in your marriage, and and after 2 or 3 years after you have had your child, the relationship is going to break anyway. So the biggest problem with sexless marriage is, most sexless marriage ends up, largely in divorce. Even the good ones where there's adequate sex. There was a beautiful study in the Journal of Marital Therapy which said that only about 40 to 50% of the marriage ever lasts beyond 5 years. Large proportion of even good marriages end up in divorce. So imagine a marriage that's sexless. It's definitely going to go bad. So the ideal solution is to first sort out the sexlessness in the marriage, then plan for a child later. So I hope you enjoyed this video on treatment of sexless marriages. This is Dr. Shah. Drop in your comments. Please like, comment and subscribe, and of course, please share this video with all your friends and loved ones. I know it's a private video, but you may be helping someone in need. So do share, like, comment. This is Dr. Shah, and I'll see you soon with another video.